Scapula may look simple, but once labeled, it shows multiple important anatomical landmarks. Let's understand all the label parts in detail. The spine of scapula, a prominent triangular ridge on the dorsal surface, divides the back into supraspinous fossa above the spine and infraspinous fossa below the spine, ends laterally as the acromion process. Acromion process, a broad, flat, expanded projection continuing from the spine, overhangs the shoulder joint and has a facet on the medial border for articulation with the clavicle. It is palpable at the tip of the shoulder. Coracoid process projects forward and laterally like a hook. Provides attachment to pectoralis minor, coracobrachialis, and short head of the bicep brachii. Glenoid cavity, a shallow, pear-shaped cavity at the lateral angle, articulates with the head of humerus to form glenohumeral joint. Supraglenoid and infraglenoid tubercle. Supraglenoid tubercle above the glenoid cavity, attachment for the tendon of long head of the bicep brachii, and infraglenoid tubercle below the glenoid cavity and is attachment for the long head of the tricep brachii. Suprascapular notch found on the superior border near the root of the coracoid process, bridged by the superior transverse scapular ligament, converting it into a foramen for the passage of suprascapular nerve. Fossae. Subscapular fossa, found on the posterior surface, is broad concavity for subscapularis muscle. Supraspinous fossa, on the posterior surface above the spine, is a small, shallow house for the supraspinatus muscle. And infraspinous fossa, on the posterior surface below the spine, is large concavity for the infraspinatus muscle. So these are all the label parts of the scapula. Knowing these landmarks makes it easier to understand muscle attachments, which we will explore in the next video.